morning, West Coast. Good afternoon, East Coast. And hello, friends in between. Welcome, everyone. Yay, it's our 28th in a series of Denticon webinars. Use it or lose it, maximizing your dental insurance benefits before the renewal date. It's that time of the year, isn't it? And welcome, everybody, and I'm glad you're here for this great presentation. My name is Kathleen Lee. I'm the Director of Customer Care. Today is Wednesday, October 31st, 2018, 9:05 a.m. Pacific Standard Time. Happy Halloween, everybody, and I hope it's a great day for you all. Now, today's topic, talking about insurance benefits, renewal dates, anniversary dates, use it or lose it, right, patient? Maximizing your dental insurance benefits before your renewal date is going to be presented by both the lovely Charmaine Beershank, my fantabulous, wonderful Assistant Director of Customer Care, who's also an expert in all things Denticon, so I give her that crown, and our special guest today, Chris Gray of Dentigram. And Dentigram, if you don't know, is our integrated appointment confirmation system and patient communication tool. Really great system. If you don't know about it, please lean on Chris for some more information. Really great system to help remind patients of their appointments, text, emails, and also what they call blueprints. So kind of if-then statements. If a patient had this done, then send them a text and email reminder about the other. So anyway, the format is, as you probably know, a 45-minute presentation of the topic, 15 minutes of Q&A. Yep. And after the webinar, a recording will be sent to you all, so you don't have to say, hey, where's my recording? Can you email my recording? Well, you're going to get it. It's going to be automatic, so you can replay it. You can review it. It'll also be posted in the help portal for easy reference. So not just for you. Don't worry even about the email, but you can also tell your other team members in the office, hey, this is a great presentation. You should watch it. Show where they can find it in the help portal. Notice, yes, you are all on mute, but you can ask questions. We want you to. How? In the questions chat section. I'll be monitoring the chat. Well, Charmaine is going to present her bit, and Chris as well. But just to let you know, you might want to hold your questions till the end, because guess what? We just might address it, and I don't want you to miss the content as it's being covered. So we have about, I would say, 75 registrants today. So it's a great turnout. 75, Charmaine?
Yes, absolutely.
Oh, cool. And if we don't happen to get to your question, by the way, guess what? Yes, submit a ticket in the help portal, and we'll reach out to you directly. So if you have a question that's very unique to you, your patient, your office, we'll give you that love through a ticket. All righty, so a little bit about end of the year. So right, end of the year, right, 2018 to 2019 is when most insurance plans benefits renew, although we have plenty of plans that renew, every month of the year. So what we're going to talk about today is something that you might want to, consider, right, at the end of every month, because there might be some plans whose renewal dates might be in March and April and June. But this is the big one, right? So starting January 1st, 2019, patients that have insurance with an anniversary date of 1/1 in the insurance plan screen, January 1st, is when their maximum is going to reset, which is great. But also, so will the deductible, which means that their deductible, if you're from the Bronx, that is a challenge, that their deductible will need to be met again. So that's out of pocket for the patient. So if a patient needs treatment currently or is due for preventive treatment, their cleaning, their prophylaxis, and has benefits remaining in this year, 2018, and maybe even met their deductible already, it would be best for them to have their treatment rendered sooner than later in the year 2018 versus 2019 in order to avoid the out-of-pocket expense of meeting the deductible again. And also in terms of preventive, where the deductible is usually waived, it makes sense to have that prophylaxis performed while they have the benefits remaining to cover them. Yes. So Denticon has reports that will identify who these people are that meet this criterion. And in hand with this info, though, will be Chris Gray from Dentigram, who can show you how to identify these patients and alert them through various electronic methods to educate the patients and have a call to action to schedule their appointment before the end of the year. So this is great for the office, right? Because you folks won't have to do anything in terms of Dentigram. That's done automatically, as well as it's great for the patients to allow them to maximize their insurance coverage. Fantastic, especially for a cleaning. That's an easy one. So that's a win-win.
So we let them know, hey, by the way, you got some money left on the table, and let's use it before you lose it. So very good. As you know, if you've ever been in any of our webinars, we do like to understand who you are, who's attending, what's going on, who's reaching into our sessions. And so we really do appreciate your weighing in. We've got several polls along the way, and so we do encourage you to weigh in on that. They let us know who's here in the sessions, how we're reaching our audience, how we can make Denticon better for you in the future. So understanding who's here and what tasks you bring, what concerns you bring to the table, those really do help us. So it looks like as the polling, the voting has slowed down just a bit. So we're going to give you a live countdown just to make sure that you get your vote in. As we know, this is election season, and we want to make sure that every vote counts and that every person has an opportunity to vote, and encourage you to do so, not only in Denticon, but in the world, of course. We're going to give you a live countdown on that. We're going to do 5, 4, 3, hurry, get your votes in, 2, and 1. Let's close that poll and share for everyone that we have a majority of people here from our multi-location brick and mortar standard, quote unquote, dental offices, followed pretty closely by the single locations. We welcome everyone, of course, and then we do have some people there from our mobile dentistry side of the world. And so we welcome everyone here. We really want to take a real, I'm going to take another really quick poll to understand who you are in this session. What is your role? What tasks do you normally play as a predominant role in your dental organization? Letting us know more specifically who's in our session. Who have we reached to intrigue, saying, hey, I really want to attend this session. And so we do greatly appreciate you letting us know that as well. Lots of various tasks that you're seeing there. If you're more of a clinical, front desk-ish kind of person, whether you're a clinical type person, whether you're an insurance biller predominantly, if you're corporate staff, and we really do appreciate you letting us know who we've actually reached in these sessions. So once again, looks like the voting is slowing down a little bit, looking like it's getting to the end of those poll days. So let's do, again, a really quick live countdown for that. Let's go 5, 4, hurry and get your votes in, 3, 2, and 1. And let's share that and let you see that the majority of people are from our office administration side. The practice managers are office managers, closely followed by corporate staff, and then an even split, clerical and insurance billers. A few little dentists or hygienists or assistants out there not making up much of the poll, but you're very, very valuable because you want to make sure that your treatment that you wish to perform on the patient actually gets accomplished with benefits remaining. So we really do appreciate all of that input. All that weighing in to let us know who you are. There you go. All right. So thank you very much. Applause, applause, applause. So as Kathleen mentioned, we've got information in the help portal. Let's just go take a real quick look about information that we're going to be talking about in our lovely help portal. As everyone knows, that it is a searchable knowledge base of all things Denticon. Every link that is in here is written by our staff, and it pertains just to Denticon. So it's a lot of people call it Denticon's Google search. We're all used to Google searching on our phones and on our iPads and on our computers and whatnot. How do I know how to do things? So think about this as your own little repository of information just about Denticon. So anything you want to know about the Denticon program or associated products such as Dentigram and other things, it's all pretty much right here. And as you see, it's all clustered in very meaningful topic areas, so forth. I'm just going to say, hey, I'm going to cheat a little bit. I'm going to search for benefits remaining, and I start getting some really quick responses there, and I say, oh, wow. Yeah, this is a topic on the table. It's nearing the end of the year, and we want to make sure that all of our patients have maximized their yearly benefits. And so how do we generate reports in Denticon to know which patients have benefits remaining? So this is going to guide us exactly what we're going to look at in Denticon, the reports that are there. And so not only the written word about how to accomplish our tasks that we're going to review, but it also gives us some lovely screenshots about where those reports are, how to generate those ideally, and a little sample of those reports as well. So we know that you love Denticon's help portal because we see so many of you using that. and we do greatly appreciate that. So, all right. So who in our lovely test account, our presentation account, do we need to understand? Hey, they've got benefits left. We don't want to let them leave them on the table. Let's go find a list in Denticon about who we need to contact and perhaps for what. So we're going to go to reports and insurance reports because topic is, of course, insurance-based. And we're going to generate this one right here. And also we're going to generate this one right here. So as we see, they're both labeled that we're going to consider any patients who had insurance already attached for which they still have unused benefits. They still have some remaining money left on the table for a benefit year. And very specifically, do they have treatment plans to be able to use those benefits? Or are they on recall that we need to get those people in to get those really quick cleaning and x-rays and perhaps periodic evaluations and so forth from our recall list? So we're going to use this one real quick right here on treatment plans. We're going to just say that we know that we've got to do an anniversary date range. And one of the big questions we get in the support team is, hey, my report's not coming up correctly. Well, notice that it's very specifically saying what is the next upcoming benefit rollover year. So we would not be using January 1st, 2018 in the start date. We would want something beyond. When is the next time that an insurance plan rolls over? Well, I'm going to say right here at the end of October. Wow, it's hard to believe it's already October 31st. Happy Halloween to everyone, by the way. Hope you're dressing up in your offices, and we know a lot of you do. The start date, I'm going to say, hey, I want to know any insurance plan with an anniversary date, rollover year, November 1st, tomorrow. And I want to say on my ending date, I really don't want to go out for the next year. I certainly could if I want to, but here at the end of the year, as Kathleen said, most plans do roll over January 1st. So we're going to change that ending date to January 1st. So any plan that any patient in my dental organization in this location, and this report is location by location, so if I need to get it for each one of them, I need to make sure that I generate this report for each of those two locations that I'm seeing over here. I'm going to say for any plan that rolls over November 1st and any plan that rolls over up to January 1st, I'm going to get a quick report there to let me see all of that good stuff. And so it says right here at the top of the list, Miss Catherine Arman, oh my gosh, she has a treatment plan that's really expensive. It looks like almost $7,000. And she has a Delta Dental plan that rolls over January 1st. She right now has this year $709 available this year before she gets new benefits January 1. So certainly there's something in her treatment plan that we can find that says, hey, Catherine, let us help you spend that remaining $709. Let's get that done this year so that next year when you get new benefits of $2,000, your money stretches further. I love that. Now here, Ben Bright, oh my gosh, only $410 in his treatment plan left to be done. He's got a lot of benefits remaining that we really could say, Ben, you got no excuse to not use those benefits, right? He might have something that comes up next year that he would have gone, oh my gosh, why didn't I do that last year instead of waiting till this year? Very good. All right, so right here it also says that this person does not have any treatment plan procedures left to be done. Good thing he doesn't have any insurance benefits remaining. So he's a little off the hook. We can let him run out of the door. We don't have to worry about him so much. But the others, yeah, there's still money left on the table in this insurance remaining column. There are still treatment plan procedures left to be done in these patient records. Let's get a hold of them in order to get those treatments done. Love it. I hope you do too. There's also, as we mentioned, right here for recall, focusing only on the recall procedures. And so once again, the anniversary date range considers when is the next upcoming benefit rollover year. So I'm going to use those same rollover year parameters, November 1st through January 1st. And I'm going to say for my recall due date range, I maybe want to say, hey, let's just do this for perhaps the entire year. Someone was due or overdue starting in January 1 to an ending date. Let's go to the end of the year, December 31st, because that's usually, as we know, rolling over benefits on January 1st. We want to capture anyone that has recall due up to the end of this year. So that should give us some really great information for these patients in our test account to be able to say who still has some recall due procedures that need to get done when they still have benefits. And so Samantha Smith, it shows her on 2 lines because it's specific to each recall code. So she should have a FMX and a Pano that is recall due in August of this past year. Hey, by the way, Samantha, let's go ahead and get that done because you do have some insurance remaining benefits of $1,556, and we just need to go ahead and get that done for you. Let's use those benefits so that we can use the $2,000 for anything that comes up next year. Do yourself a favor. Mr. Hilton here as well, due December 1st for a periodic oral evaluation and a prophy. Hey, Steve, we need to get you in. You've got $869.80 left in your benefit package for this year. Let's get these 2 things done so that we can use your benefits next year for an additional prophy, additional periodic, and anything else, again, that comes up in your history in our dental organization. So we know that you're going to love those reports just to generate who do I need to consider to let Dentigram say, hey, by the way, Samantha, Steve, all those other people that were on our other report, let's get those things taken care of so that we don't leave benefits on the table. Because I don't want to use my staff time in order to make all those calls. I want Dentigram to help me out on that. So let's just take a real quick poll real fast as we launch that over to Mr. Gray here to take care of his part for Dentigram. How many of you use any kind of electronic patient communication to communicate anything about your patient's association to your office, whether it be benefits remaining, whether it be appointment reminders or recall appointment reminders, or hey, you need to come in for recall reminders? All right, so let's do a real quick countdown. 5, 4, 3, 2. Let's get that voting in. 5, 4, 3, 2. And yeah, I backtracked. 2, 1. Let's go that. There we go. Close and share that. Thanks very much for letting me go backtrack on that. You bet. The majority of you do. Yes, and we're so grateful that you do. We know that you enjoy using those features. Now, the big question is, Mr. Gray here in the house, we're going to turn that over to him as we do. Does your dental organization use Dentigram for that patient communication? What do you do on that? Yep. Do you do it? All right. So eagerly waiting. You're getting the hang of this. By the way, this is the last poll. I won't be bothering you anymore for those. So get those votes in really quickly. So 5, 4, 3, 2, and 1. Let's close that and share that and understand that. Let's click the share button. There we go. That a majority of you do not yet use Dentigram. A great number of you do. We do appreciate those people who do, and those people who are not, we do encourage you to consider. Chris is going to give you some wonderful bits of information about how to make your lives easier. So Chris, without any further ado, welcome, my friend. Thank you very much for sharing the Dentigram greatness.
All right. Good morning. Can you hear me okay?
Absolutely, we can. Thank you.
All right. Perfect. All right. And is it my screen? I want to click this. All right. And can everybody see can you see my screen, Charmaine?
Beautiful.
Yes, indeed. Thank you.
Okay, perfect. So anyway, welcome. Good morning, everybody. I just want to share with you a quick Dentigram tutorial on the remaining benefits. So as we've been speaking about that today, we do have several blueprint campaigns that we use. Yes.
Chris, I'm sorry. I put a little stop there. Since we know the majority of people are not even using Dentigram, can you just give a real quick recap of what Dentigram is, what Dentigram does? How about that? Would you mind?
Sure, not a problem. So
yeah.
Dentigram is patient communications, and it is run with Denticon. In fact, it's heavily integrated with Denticon so that you can get your maximum usefulness and efficiency out of it. And what we do is we send messages either by email or text to your patients for specific situations. For example, appointment reminders, appointment confirmations. We also have recalls that we can send out to your patients at specific intervals when they're due for their next prophy or another procedure. We have other patient appreciation and stay on top of mind blueprints such as Happy Anniversary, which is actually the anniversary of the patient's first visit, and a lot of people don't know that, their first day at the dental office, but like I said, it's a way to show patient appreciation and stay on top of mind, because somebody might see that and say, oh, maybe I should call them. I haven't been there in a while. Obviously, we have a happy birthday here, and these emails are customizable. You can change them. In fact, one office we have actually sends out Starbucks cards to their patients, and their email adds in a note that says, please see us about your birthday present on your next visit. We have a lost patient recovery, which would send out emails to your patients 11 months, 12 months, and 13 months since they've last been in your office, sort of trying to get them back into your office and, kind of telling them, hey, listen, if you lack oral hygiene, if you don't take care of your teeth, bad things can happen. We have a missed appointment blueprint, which will go out to patients after they've missed their appointment. Our new patient and post-visit thank you emails are emails that go out to the patient after their first visit in regards to the new patient, and one day after a visit by an existing patient here on post-visit thank you. The reason I brought both of these together is because they both include a survey, and it's an internal survey. It's 10 questions, but you can actually change the questions if you want to, or if you have a default link, you can put your survey link in it, and it can ask certain questions about to your patients. They can answer honestly and give you some feedback, and you can actually see those messages here in our interactive reports. You can export the survey responses. They'll come on an Excel spreadsheet, and it will, excuse me, give you everything you want to know about that patient. Just in case you need to make an intelligent phone call, if anything happens, you'll have that information. We also include our review portion of our service in these two emails. These two emails, we can put little icons at the bottom of the email, whether you have a Google page, a Yelp, a Facebook, health grades. We put up 4 icons, up to 4, and then we also have a service that follows up to about 20 other websites. So if you have a patient that wants to leave a review, whether they got there from our emails here or they're just avid Yelpers or Googlers, then we can email you that review so you don't have to monitor those sites yourself. We also have, I should go back to the confirmations and reminders, we also have several times in which you can send these confirmations and reminders, and you can actually send these by either email, text, or both. And the same with reminders here. You can send them at different intervals. Once the patient confirms, it automatically goes on to the Denticon scheduler, marks that it's confirmed. There's nothing for your staff to do. There's nothing for the patient to do. And they will receive a one-day appointment reminder the day before the appointment to remind them that their appointment is the next day. In regards to the remaining benefits, we will send out remaining benefits messages 90 days before the benefits expire and 60 days before the benefits expire. And in the benefit email, excuse me, we basically tell them, hey, use it or lose it. We kind of warn them that their deductible doesn't roll over and your dental problems can worsen if you don't help yourself out by getting to that dental office and spending that money and fixing your teeth and have that nice smile. We can send those emails out to everybody in your office at the specific time, or we can send them just to specific patients with specific insurance, such as PPO or indemnity. And that's pretty much a quick overview of Dentigram without having a demo. I encourage anybody who's more interested in a demo to contact me or Kathleen or Charmaine, and we definitely can set you up with a more broad demo of Dentigram. But it really is very efficient, and like I said, it works in the background, and there's not too much you have to do, but it is a great program, and I highly encourage, if you want to get a hold of your patients and don't want to spend 15, 20 minutes a day calling patients, being on the phone even probably longer than that, this will definitely help you. And does anybody have any questions? Charmaine, I don't see Charmaine Kathleen. I don't see any chat messages, so I was just wondering if you see anything.
I'm not seeing anything so far.
But
Okay.
I have a couple of questions, Chris. So in terms of the benefits, so that's you said a 30, 60, 90. Can you go back to that for a second for me? The benefit remaining, yeah. So when do those go out again?
Those go out 90 days and 60 days. Now, in the interim, we actually have, currently, if we're speaking on October 31st, we have 90 and 60. We're actually going to be adding a 30-day sometime down the line. And before that, even in the next few weeks, we have an on-demand campaign feature, which you will be able to send out messages on your own. You'll be able to filter a report of patients with certain criteria. I don't know, for example, somebody who hasn't been patients who haven't been in the last 6 months, or if you have to tell your patients that you guys are moving your office somewhere, or you're welcoming a new dentist to the practice, or for those of you out in the snow, there's a snow day today, we have to close. Those are all messages that you'll be able to send on demand. And if you want to add an additional note or two in regards to remaining benefits, you can do that as well by pulling the Denticon filter or the Denticon reports and then emailing those patients out. And that's going to be coming out in the next few weeks here by the end of the quarter. I don't have an exact date for you right now, but I just know it's supposed to be this quarter. I just want to add that in.
So I know you already did a promotion, and you're all of our Dentigram customers are already in the midst of this blueprint, so to speak, already working. What happens if I have a plan that renews, in other months and such? And I have a doctor, I think it's Dr. Joshi, is asking, hey, is Dentigram included in Denticon? And if not, what are the monthly fees? If you want to speak to those two questions, that would be great.
It tracks the patient insurance information. So if the patient has I don't know, an expiration date of March 1st, then it'll be 60 days from March 1st, 90 days from March 1st.
So it knows that already? Are you saying, Chris, it's doing this automatically, or is this just the campaign for the January the 1st? Oh.
It reads the actual patient's insurance information. Now, grant you 85% of the patients probably have a January 1st rollover, or yes, a January 1st rollover date, but it does read when other patients, or when patients who have different months, it'll read those as well.
I see.
And the second question, in regards to the Denticon as part of Dentigram,
right.
Yes, in fact, I wish Lisette was on the call because he knows more about this. But apparently, there's a Denticon package that Dentigram can be included in there. I forgot what it was called. I'm driving.
We'll make it up, Chris. We'll let Lisette deal with our lives. All right, we're going to make up a word. The bundled package.
I think it's called the professional bundle practice or something, like that. But.
Good.
But I just Denticon is the solar system. I just run Earth, so I don't speak too much on the pricing. But the standard pricing is $85 for basic and $199 for premium. However, there's other things that you can add. Actually, that's $215. I apologize, but there's certain different aspects. I don't like to discuss pricing too much because there's certain things that the sales team can do. For example, if you have multiple offices, there's a discount for that. There's like text bundles that changes the price. I mean, so there's different things, but it's around those two pricings for those two packages.
And I would assume you're more than competitive with a Solution Reach or a Demand Force or a Lighthouse 360. What do you say to that? Since we do have people that are not, the majority that are not, and here's an opportunity for you to maybe speak to those and entice them to a much better integrated system. So tell me a little bit about that.
Yeah, so we are less than Dentigram, or excuse me, Dentigram, less than Solution Reach and
Their systems have a lot of support with their bridges and their integrated products where Dentigram and Denticon are kissing cousins, so to speak, and they work very nicely together. So, hey, in terms of blueprints and such like that, and blueprint being a kind of if something or other, then something or other, one of the questions Jeanette Hellman has, and welcome, Jeanette, and thank you for your question, can I use Dentigram to remind patients that a bill is due?
You will be able to do that soon, not this time. But you have a report here. I don't think I can pull it from here, but there is a report here in the appointment summary task list that you can run a date range. And what this will show is your patients coming in chronological order, but when this chronological order report pops up, to the right, there's going to be a balance, and you can actually see if somebody's due for a balance. That means when somebody's coming in, you can actually call beforehand, or if they walk in the door, you can let them know, hey, you have this amount of money due.
So it's more of a report based on the appointment. So a call can be made, but not necessarily a text or an email, so to speak.
Well, not an automated email, but what you can do, if you see, for example, in a report that you have a balance, so you can actually go to the database and select the patient, and if they have, give me 1 second here. Just trying to check my demo office. If you were to click on a patient's name and they have SMS here, if you go to options and you have SMS, you can actually send them a message like, you owe me lots of money or something like that. You can send that message to them. And if they have an email on file, you can also, it'll say send an email here as well if they have an email as well. That report that I also mentioned earlier about that appointment summary task list, that report will also show you what's missing from your patient profile. So, for example, if they're missing an email address, if they are missing a cell phone number, it'll tell you. And as patients walk through the door, you can get that information from them, put it into their Denticon patient portal, and activate. And you'll have more numbers. I never showed this page up front, but right here is what shows you how many percentage of patients you have this communication for. So, for example, my demo office has 78% of patients by email and 84% of their patients' cell phone numbers. And we like to see that number go up to as close to 100% as possible. That's why we give you that report, so you can start building your clientele, because Dentigram is only as good as your data, so we want you to have as much as possible. While I'm here real quick, let me just show you that this is the amount of communications that have gone out in the past month. That's broken down by emails and text messages right here. And this fulfillment chart shows you how many messages your office has sent out in the past 7 days. And if you click on any of these links, it'll show you, it'll break it down by text and email, how many of those are text, how many of those are emails. And this will be your future appointments on your Denticon scheduler and your database side, which is made up of patients, providers, and responsible parties. So your actual patient count is probably about half that number. And our import date shows that Dentigram and Denticon are syncing and getting together to sync your data.
Got it. And so I have a couple of other questions here too, Chris. Is there a way to customize that, use it or lose it message?
Absolutely.
Yeah, if you want to talk a little bit to that. I think that's Michelle Hahn that asked that question.
Yes, so most of the time I'll do the customizations. They just tell me what to do. Goodness, I'm trying to see. I don't want to X out the boxes with the.
No, that's okay. You can mention it, and can it be different for each patient? So if my remaining maximum is 200, your remaining maximum is 900, Charmaine's remaining maximum is 1500. Is it that smart? Can it be that smart and kind of integrate those nuances and those details?
Not this time. It's a generic email, but again, on our roadmap currently, we're building this is Dentigram version 2.0. We're actually building a 3.0, and in that 3.0, they will have the amount of money they still have left. Yes. So what I was going to do here is go to the HTML body, and you can actually change this this message if you want to say something else like "come on in" or something like that. You can change and you can save it, and it'll change the message, and you can actually preview to see what the message says. So it is customizable. I generally do it because I don't want anybody to mess up the merge fields. But if somebody is confident, I will give them the directions to do so, and they can change it on their own at their leisure. And anything in Dentigram is not written in stone. When you decide which blueprints you want to use and when the intervals of the communications you want to go out, if you go to sleep and wake up from a nightmare saying you need to change it, then we can change it the next day. It's very, very customizable, very user-friendly, very easy to do.
Good. So you kind of start us off with some good verbiage, which I like. If I want to tweak it, the customer most certainly can. And in terms of remaining deductibles and maximums and that kind of information, that's coming up in another update, so to speak.
Yeah, in a future update, yes.
Dentigram, because of course we can feed you that. So speaking of getting you information, Anaga Yoshi is asking, how long does it take to sync the data into the system? Is it done in an hour? So if I enter a new patient into the system, Denticon, does it get integrated into Dentigram to send those communications?
It will come over in the nightly sync. So every night we have a nightly sync. That's what this last import date represents. So we have a nightly sync, and depending on where you are in the queue of syncs, whether it's before midnight or after midnight, that will be your last import date, and it will sync that information over that evening over Dentigram. Now, on the other side of things, when they click that, let me show a quick message here. Let me do the email so you can see it more clearly. Now, if they click the confirm button, once they click the confirm button, it will automatically go on to the Denticon scheduler. That happens in real time. So it happens almost instantly. But if you put in the patient's info, like you say, for example, you finally get their email message or emails or cell phones when they walk in the door. If you put that into Denticon, you'll be able to start text messaging that person the next morning.
So in terms of automated bulk text messages and such, if I put in a patient today, the nightly sync occurs at midnight tonight, more or less, and then they're in the database. Everything is good to go. As usual, when it comes to appointment confirmation, though, and appointment cancellations, that's a little bit more real time. And then in terms of let's see. So yes, I think that makes sense. So the appointment, if they confirm an appointment, that's real time. But in terms of adding the patient into Denticon, that syncs at midnight tonight. Is that true?
Somewhere around there, yes. That's correct for the most part, yes.
Okay, perfect. So, and then I think I see another question with Dr. Yoshi. Is it automated, or do we have to sync it manually? So I believe it's automatic, right? I think I learned from you guys to set it and forget it, right?
Yes, set it and forget it. In fact, that's down here at the bottom of the screen here. Set it and forget it. This is all automated. There's nothing for you to. You don't have to submit. You don't have to send any messages to your patients unless you want to. All these communications that I just went over in this call are automated.
Exactly.
And based on trigger points.
Mm-hmm. That's right. So once you have Dentigram, yep, the integration is automatic. You add the patient, they'll be there more or less, let's say midnight tonight. Patient confirms an appointment, at 9:30 p.m. this evening for an appointment for next Tuesday. On the other hand, that is real time. That is automatic, right?
Correct.
Yes. Okay. Fantastic. All right. So some good stuff. So a lot to look forward to. And then if anybody is interested in any more information about Dentigram, a demonstration is free. And that's what I always tell people, demonstration is free, and that's free information. So even if it is to compare what you're currently using to Dentigram why not? I think it would be worth it. And if you're not using an automated confirmation system, you should definitely take a look at Dentigram demo at the very least. And the beauty of that is that it's automated. So those appointments are in the system. The reminders for those appointments go out automatically. Those confirmations that the patients, indicate for the appointments are real time. And it's a little less phone calling and upfront, let's say, busy work for the staff, but by all means, staff can always reach out to the patient. But the set it and forget it of appointment confirmations and just that constant contact with the patient, right? Those touches with the patient, the happy birthdays, the happy dental anniversary, the where have you been? It's been over a year and a half. I know for the patient, time flies when you're having fun, but yes, it's been over a year, which means that's at least 2 cleanings that you've missed are great blueprints. I'm trying to use your words, Chris. Great blueprints that, again, you can just set and you can forget. So beautiful. All righty. Any other questions, my beautiful, wonderful, kind audience out there? Not too much, and I'll let you guys think about it. Charmaine, I have a couple of questions for you. So if you wouldn't mind, we'll take it. We'll take the screen back from you, Chris, for a moment.
Sure.
And then making that happen?
Yeah.
Sure, and as we're making that transition, so go ahead.
Yes, exactly. So we were talking about insurance benefits resetting. So if you don't mind, Vanna White for me, that actual field in Denticon that we're all talking about here, actually, that old anniversary date in the actual insurance plan.
You bet. Let me get back to where my stuff was. There we go. All right. And so, here we go. Going to the patient record. You bet. And so viewing an insurance plan from a patient right here, I just click the words view insurance plan right there on the screen. Quick, easy, fastest way to get there is from a patient's review screen. And it says right here that our anniversary month and date benefit rollover is January 1st.
Exactly.
Very good.
That's the trigger. Exactly. That's the trigger right there. 1-1. Okay, fantastic. So, who is going to reset the benefits? How does that actually work? So it's kind of a two-pronged question. You know that, Charmaine, right?
Sure,
so if you wouldn't
absolutely.
mind, let's talk about the January 1 versus every other month.
You bet. You bet. Well, Lovely Health Portal's got some great information about that. But the biggest bottom line is that because the vast majority of U.S.-based insurance plans roll over January 1st, we want to help you do a favor. And we also want to make Denticon as responsive and speedy as possible. And because everyone across the country trying to reset all their benefits for all the patients and all their plans on January 1st, oh my gosh, what a belaboring of the data and processing in our servers. So what we've done in the past several years is that the Denticon team will take the task on for you for any plans that roll over January 1st. We do that seamlessly in the background without any interaction from you, without any necessary action by you as well. That our team just takes a look at everyone across the country, all of the users, every plan that rolls over January 1st, we will reset those benefits for you on New Year's Eve and New Year's Day. So you don't have to do any action for those. That does happen seamlessly. For those plans that roll over in different parts of the year, February, March, April, May, etc., all the way through December, for those 11 months, we ask you to manage those because we recognize that for the vast majority of times, there are limited plans to do so. And so there's very little stress on servers and activities and database access. So to reset benefits within your organization in various times of the year, again, February through December, we're going to go to this lovely little feature down here called Closeout. And we see at the bottom of the Closeout screen that there's a section for resetting insurance benefits. And as it says, it's used to reset the insurance benefits when the insurance plan anniversary month is equal to what is specified below. Well, the good thing about Denticon, it's proactively smart enough to know that right now it is still October, so it automatically reads reset the insurance benefits for October, and that means for benefits, for insurance plans, any plan, we'll just revert that to October for a moment. Reset the benefits. Am I absolutely sure I want to reset the insurance benefits? Again, for only the patients associated with a plan that rolls over October. Very good. And so it's not going to touch anybody for February or March or April or May or June or July or August and so forth, just does October. So that gives me a nice little message, very quick and very easy, that those benefits were reset. Now, what happens if I don't remember to do that? And we do recommend that you consider this at the first of every month. So the first day of the month that you're working, come to the screen, reset those benefits, boom, you're done. What happens if I forget? Well, it's going to pop up a little message in your patient's record as you attempt to post that says, hey, by the way, the patient has benefits that rolled over already and nobody reset the benefits. Do you really want to do that for this patient? Absolutely, you should. And that should be a little trigger to your brain. Uh-oh, forgot to do that. Let me go run to this screen and reset the benefits for the patients in my dental organization. So it doesn't matter if you accidentally forget. It does give you a little prompt that should trigger your brain. Whoop, let's go run over here and let's do this for every person in our office. So we hope that that's really beneficial for you as well. Very good. Now, as far as the insurance plans, can I get a really quick report to know what insurance plans are entered? And yes, of course, we've got that. We'll have lots and lots and lots of reports in Denticon. And I'm going to generate this one that we've, again, if you saw the pathway, go to reports, go to list, go to this long one, employers, carriers, and plans list. And I'm going to select this one for insurance plan list. It's going to give me all of my plans, sorted by however I determine those to be. And I've got those other parameters to consider, but I just want to get a brain dump, so to speak, of all of my plans in my insurance plan database and my organization's Denticon program. And right here, focusing, yep, the vast majority of mine are all rolling over January 1st. In fact, every single one of them. So that helps me. Denticon is going to help me reset every patient's record on January 1st. But this would give me a great quick look if I've got anything that's anniversary month and date, for instance, April 1st or September 1st. So we've got those plans to be able to reset. So that's a really handy, lovely report for that. Very good. Very good.
Exactly. Good stuff. Okay, I think that really handled most of my questions there, Charmaine, actually, because I have questions too. Ha so benefits can reset every month. We only do the resetting for you for the big one, the January 1st anniversary. We do that for you automatically. The rest of the months, yep, you should be doing. But as you notice in that, where is the renewal, the reset? It's right where closeout is. So it's pretty obvious. It's right there where you should be doing your closeout at the very least every month. So that's why we bundled those two nice features together. And just like you said, if you haven't been doing this, don't worry, because as you're posting treatment, the software will notice, oh, wow, it's November and the anniversary date was September. It'll prompt you, do you want to reset the benefits? And if you say yes, you'll just do it on a patient-by-patient basis. So you haven't lost anything by not doing it, although it's a good thing to kind of just get it done so your reports and such are much better. So fantastic. And great presentation. Yep, thank you, Chris.
Yeah.
And yeah, so let's wrap it up, Charmaine. What do you got for us?
Yeah, so just a really quick recap. Why would we want to use Denticon's Dentigram feature? Because it's quick communication, it's effortless, it's easy, it's uncomplicated, it's seamless. You set it and you don't have to worry about it. So we've got those great little tips to take away as far as what Denticon has to offer. As far as what Dentigram itself has to offer, why should you use them? Well, quick communication again. It's effortless. It's seamless. It has enhanced patient experience. It's automatic for you. It saves all your staff's time. It sends little reminders according to how you want them set up. As Chris mentioned, there are some customized blueprints if you want it to look a little bit differently than maybe somebody else does. They've got that ability for you. And as we talked, it's also competitively priced for you. On Dentigram's mantra, as we like to express, and we say it, whoops, there we go, go down. There we go. Oh, there we go. Dentigram says, yep, there you go. A little keyboard was not working right for me. Set it and forget it. Don't worry about it. Just do it. Just make it all happen. And so we do encourage you to use Denticon's integration with Dentigram in order to be able to have more seamless and efficient operation.
Exactly. Hey, so before we say goodbye at 4 minutes to the hour, I wanted to ask our lovely panelists of the Virtual Business Service ladies, my other kissing cousins, love them so much, my VBS team, if you're still here, any comments, theories, thoughts about just in general, since you're my insurance guruesses, end of the year, end of the month, the benefit renewal, any comments in general?
No, I think you guys said it all. The best thing is to run those reports. Make sure that you go to closeout at the beginning of every month, and then that will help you greatly with your estimations.
Exactly. Well, thank you so much, everybody, for your efforts and your time and spending this hour with us. As you know or don't know, we do our webinars approximately every month, 4 to 6 weeks, usually the last Wednesday of the month. Thank you for being here on this journey together to become Denticon experts and superstars here. And thank you, Charmaine, for being here on this beautiful journey from our first webinar to our 28th webinar together. It's been my extreme pleasure to have fun with you every last Wednesday of the month. Charmaine, love you very much.
Absolutely. You're welcome. It's been my pleasure, folks.
Yep.
Hope everyone's enjoyed.
Exactly. Have a great day, everyone. Blessings. Thank you.
Bye-bye.
Bye.
Take care. Bye-bye now.
Thank you.